Welcome to this evening's function on behalf of both the Faculty of Medicine and the Medical Foundation of the University. We're particularly delighted to have Sir Gus Nossal here with us this evening. Sir Gus really needs very little introduction. Many of you will know him personally, and those of you who don't know him personally will know of him by reputation. Sir Gus began life as a basic immunologist and as a medical student, in fact, at this university, where he graduated in 1955. For many years, he was the director of the Walter and Eliza Hall Institute in Melbourne, and arguably, I think, grew WEHI to be Australia's greatest and most well-known medical research institute. In recent years, he's turned his attention to the global burden of disease, and in particular, the role of vaccines in helping to try to combat some of the large disease problems that we confront in the world. Sir Gus is going to talk to us tonight about that, and without further ado, Sir Gus Nossal.
Professor Robinson, my dear colleagues from my old alma mater, young and not so young, and all you great supporters of medical research, I can't tell you what a buzz it is for me to be back here at Sydney University to see the amazing building extensions that are surrounding us on every side. And of course, I have followed each year the magnificent progress of this foundation. It's a very sobering thing to reflect on the fact that I graduated in medicine 53 years ago, so this foundation hadn't even been thought of. And indeed, one might describe the state of medical research at the Sydney University Medical School as reasonably parlous in those days because of shocking staff-student ratios and chronic underfunding. So what a transformation. And this foundation has been a very big part of it. I particularly applaud your emphasis on early career, the superstars of tomorrow, the fact that you've given people a great start on what in many cases have come to be very distinguished careers. Well, you're 50 years old, so I had to put 50 in the title, and the only justification I could think of, would you believe it is in fact 50 years since the first halting steps towards the global eradication of smallpox were taken by the World Health Organization. Unfortunately, they didn't get their act together for quite a few years. It wasn't until they appointed D.A. Henderson that the thing really romped ahead, and then they did the job just 1 year short of the 10 years that Henderson had set himself. And really, the main thing that I want to talk to you about is the last 10 years in global public health, when genuinely some rays of hope have emerged in what could be described as rather a dark area. I want to embed my talk in what I see as a very major current that is sweeping through the development aid field generally. And I'll date the tipping point to July 2005, when the G8 met in Gleneagles just a day after the shocking London terrorist bombings. And there, the G8 committed themselves to a new moral imperative to get rid of extreme poverty in the world, inter alia to double the aid to Africa. And I think what is different now from, say, when D.A. Henderson started smallpox eradication is that in most of the developing countries, there are now academic and other leaders who are genuinely in a position to act as partners to a partnership with the aiders and the aided, linking arms and going forward together. That, of course, is the only way that international development aid can possibly work. Now, I think one thing, if there's perhaps no other message from tonight's talk that I'd like you to take away, is that politicians promise things and they don't always deliver them. And it is up to us as a civil society to hold the politicians to their promise. We're already halfway to the Millennium Development Goals set out in year 2000. We're halfway to 2015. Already the countries have fallen well behind where they promised to be. And we have to hold the G8 and others to their promises. Now, I used to talk a little bit about a global Marshall Plan. Imagine my utter surprise when at that G8 meeting in 2005, Gordon Brown, the present Prime Minister of the United Kingdom, used those same phrases and said what we need is a new Marshall Plan. And look at what US Secretary of State George C. Marshall said 60 years ago, that's even before you were born, as a foundation. And how these words would resonate today. He said, our policy is directed not against any country or doctrine, but against hunger, poverty, desperation and chaos. There's no doubt in my mind that the whole world hangs in the balance. And the Marshall Plan, which reconstructed Europe, cost the USA 4% of its GDP for some years. That's today's equivalent of $500 billion a year. And so I think in the context of that, if we had a new Marshall Plan, we really could make poverty history, and health fits into that. Let's just have a look at a few simple figures. The world can easily afford that which Lester Pearson put before the United Nations now more than 50 years ago, and that 0.7% of GDP for aid. World GDP is 60 trillion, 60,000 billion, or if you want, 60 million dollars. It's growing at 5% per annum. The European Union GDP is 18 trillion. The USA GDP is 14 trillion. And just to throw one in out of left field, nations not particularly noted for their foreign aid contributions, the Arab League GDP is 1.8 trillion. Considerably higher, in other words, nearly twice that of Australia. Now, if these countries gave 0.7% of GDP, this would total $280 billion, a sizable sum indeed, whereas current official development assistance is $105 billion. That's a big gap. The OECD average is actually 0.3% of GDP, and only 5 countries are at or above the 0.7%, namely Norway, Sweden, Luxembourg, the Netherlands and Denmark. The USA is at 0.2%, Australia is at 0.3%, admittedly planning to go to 0.5% by 2015. Now, it's not just the level and quantum of aid that I want to discuss with you, it is also the distribution. Because sad to relate, many countries look at official development assistance as a mere tool of foreign policy and not as an essential to relieve poverty. Look, for example, at the distribution with Iraq, sanctions now having been lifted because of politics, 15% of that total of 105 billion. The totality of sub-Saharan Africa, with 700 million people living there, only 20%. Now let's come to health. We, of course, think of health chiefly from a humanitarian point of view. I guess that's why most of us are in the health sciences one way or another. So we want to improve the lot of humankind. But what's got to be understood is that health is very important from an educational point of view. A sick child can't learn. And it's also very important from an economic point of view, because the sick child becomes a sick adult, or the sick child is looked after by an adult that can't go to work because of looking after the sick child, and so forth. And when you think about this, there's a kind of a virtuous circle that unites health, education and economic growth. Gro Harlem Brundtland is an unusual individual. She was twice Prime Minister of Norway, And she has the distinction of heading the Rio Summit on sustainable development, when that word was first coined, the great Rio Summit on the environment. And she became Director General of the World Health Organization. And during that time, she commissioned what she called the Commission on Macroeconomics and Health. She got some hard-headed economists from the World Bank and elsewhere and said, explain to us how much it would cost to bring decent health to the developing countries and what would be the economic implications. And they came up with the statistic that 41 straightforward life-saving interventions would cost $40 per person per year and save 8 million lives per year. That's the humanitarian benefit. The economic benefit was seen as $6 for every dollar spent. How many government programs can you think of where the cost-benefit ratio is 6 to 1? And the chairman of that commission was Jeffrey Sachs. Sorry, no, the chairman was Harold Varmus, but Jeffrey Sachs, the famous health economist from Columbia University, was on it. And here's what he had to say. There's absolutely no excuse for us to live on a planet where 10 cents per $100, millions of lives could be saved every year. It's hard to understand why we kill people, but it's absolutely unthinkable how we let millions of people die when we stand by without understanding what is in our own interest and moral obligation. Now, those words are important. Yes, it's our moral obligation to bring better health to the developing countries. But it's also in our interest, particularly if the case is proven that the economic benefit that would ensue would be so great. Because as soon as you have a developing country coming out of the mire of extreme poverty and ascending into being a country in transition and then eventually a reasonably developed country, you of course create new trading partners. And the whole wealth of the world depends on us trading with one another. Hence the tragedy of the Doha round having collapsed last night, apparently. So it's in our own interest and moral obligation. Now, what should be the priorities within the health field? Well, you won't be surprised to hear that most of my talk will be about infectious diseases, but there are other things that we should consider. Nutrition is incredibly important. What's curious in this world of 6.7 billion people is that there is not much calorie malnutrition in the world today, except in countries that are the subjects of natural disasters or severe civil strife. There's enough calories to feed the world. However, there's not enough protein, and especially not enough essential amino acids. And very important are micronutrients. Now, I'm thinking here particularly of iron, iodine, and vitamin A. For example, it's not generally appreciated that degrees of iron deficiency anemia, degrees of iron deficiency insufficient to cause anemia, so a perfectly respectable hemoglobin of 12 or 13 in the kid, will still have the capacity to lower IQ significantly, particularly if present in very early life. Now, antenatal and obstetric care would be my next set of priorities. The maternal mortality rates in many of the developing countries are truly scandalous. And when mentioning birth spacing, birth control, I will say one thing that might obviate the first question, because it always is the first question after a talk of this general ilk. And that is to say, if Bill Gates eliminates malaria, or even in due course of time HIV/AIDS, he's doing a terrible thing to the world because it'll cause a whole heap of overpopulation. Let me spike that one immediately. There is now a ton of evidence to show that high infant mortality rates do not cause a lowering of population or a stabilization of population. Those countries in which the infant mortality rates are highest are also those in which population growth rate is the highest. Why should that be? Well, it's pretty simple. people aren't stupid. And if you live in a country where there is no social security, you better be sure that you have one or preferably two male heirs to look after you in your old age, because no one else will do so. So you have a look, please, next time you're up at your computer and look up Google, just do a very simple thing and ask about poverty and ask about population growth rates, and you will find that the poorest countries, which are also those with the highest infant mortality, are also those not with the slowest, but with the fastest population growth rates. Once you start to get the society into reasonable shape, people will space their births spontaneously and will limit their family size without any need of further intervention. Now, it's very important to realise that there are many countries which are still quite developing countries, but which have an emerging middle class. Think, for example, of India. To describe India correctly, you would have to say it's a rich country with a lot of poor people in it. And in that rich country, there's a middle class, and it's being subjected to the same kind of junk food and carbonated soft drinks and McDonald's hamburgers. Yes, indeed, McDonald's. And the problem of obesity and diabetes is one that's so severe they don't even realise how severe it is. Ditto China. And I would think that if we have dealt with these classical third world health problems, we'd better think about obesity, diabetes and cardiovascular problems as the very next priority. Now, am I just a totally naive optimist when I tell you there are rays of hope? Well, health progress is possible. For the very first time, a few months ago, UNICEF was able to report that in 2006 there were fewer than 10 million deaths in children under 5 in the world. The 2007 figures are not available yet. I feel sure that they would show a small further fall. So 9.7 million children dying is a lot, but it was 13 million in 1990. That is a pretty sharp rate of progress. Look where these dying children are. Of course, they're in sub-Saharan Africa and in South Asia. Among the preventable deaths of children, we have pneumonia, diarrhea, malaria, measles, if you please, where we've had a wonderful vaccine for 30 years plus. And HIV/AIDS doesn't kill many children, but of course it kills enormous numbers of adults. Now, the second thing to note is that there are now some truly pivotally important large programs abroad in the world which are making a difference. I've had the good fortune of being associated one way or another with WHO for just on 44 years now, since my old boss, Mac Burnett, introduced me to the huge problems of development. And as I sort of rose in seniority and came to be chairman of this group and that, I kept saying, we need money. We need money for new vaccines and stuff like that. And once you started to talk billions rather than millions, you were very quickly held down, because there just wasn't that sort of money around inside WHO. But now we have 3 programs that are multi-billion-dollar programs. Let me describe them to you. There's the Global Fund to fight AIDS, TB and malaria, the President's Emergency Plan for AIDS Relief, and the Gates Foundation programs. We'll have slides on each of these. And these are the big ones. But in saying that, I also want to say there are some medium-sized programs which are beginning to get traction. Out of the 7 that I've listed there, I have slides on all but 2 of them. So let me now mention those 2, because they've got a strong Australian component. Iodine fortification is hugely important. Just like with the iron, partial deficiencies in iodine, not enough to give you a goiter and not enough to make you a cretin, still will materially impair brain development, particularly, once again, if it happens when you're very young. Interestingly enough, this subject is becoming of interest in Australia, because now it would appear surveys are showing that we do not have enough iodine in our bloodstreams, and partial iodine deficiency is quite common. Eye health I mention because two of the great heroes of eye health in the world are Australians. Fred Hollows, of course, his work being carried on by Gabby Hollows and the Foundation, and Hugh Taylor, whose work in both trachoma and river blindness is absolutely outstanding. So now let's go on to the Global Fund to Fight AIDS, TB and Malaria, popularly also known as the Global Fund. This program's just 6 years old. $10.7 billion have been pledged to 136 countries. It's now running at the rate of about 2 billion, maybe a little more than 2 billion per year. 1.75 million patients have been placed on highly active antiretroviral therapy for AIDS. 46 million people have been given HIV testing and counselling. 3.9 million people are on TB chemotherapy. 59 million insecticide-impregnated bed nets have been distributed, of which more are none. 60 million malaria treatments have been given, and 7.6 million community health workers have been trained. I'm tremendously proud of the fact that the distinguished Canberra health bureaucrat Helen Evans is the Deputy Director of this thrusting program.